Rory. I'm going to be doing your x-rays today. Can I go ahead and get your first and last name?
Kayla Ramirez,
And date of birth?
9/29/95.
Perfect. Is there any chance of pregnancy?
No.
Okay. So what brings you in today? What's been going on?
I fell on my right knee and it's been bothering me.
Okay, how long ago was that?
Yesterday.
Yesterday you fell. What were you doing when you did that?
I was skateboarding.
Skateboarding? Okay. Well, hopefully we can get some good images of that knee. Go ahead and lay down on our table. Perfect. So I'm going to bring my table up first. Bring it up to about my hip. And then I'm going to bring my tube down 40 inches. Perfect. Detent my tube to the table. And then I have my IR in there lengthwise. I'm going to put my right marker on there because it's her right knee that's bothering her. Then the first view I'm going to do is an AP of the knee. So I'm going to make sure she's not rotated. I'm going to angle my tube 3 to 5 degrees cephalic. And then I'm going to make sure my tube and my plate are lined up. From there, I'm going to put my central ray. Half an inch inferior to her patellar apex. And then I'm going to collimate to about a 10 by 12. Making sure I get still a little bit of her femur and a little bit of her tib fin in the view as well. Hi, Kayla. Hi. I'm Rory. I'm going to be doing your x-rays today. Can I go ahead and get your first and last name?
Kayla Ramirez,
And date of birth?
9/29/95.
Perfect. Is there any chance of pregnancy?
No.
Okay. So what brings you in today? What's been going on?
I fell on my right knee and it's been bothering me.
Okay, how long ago was that?
Yesterday.
Yesterday you fell. What were you doing when you did that?
I was skateboarding.
Skateboarding? Okay. Well, hopefully we can get some good images of that knee. Go ahead and lay down on our table. Perfect. So I'm going to bring my table up first. Bring it up to about my hip. And then I'm going to bring my tube down 40 inches. Perfect. Detent my tube to the table. And then I have my IR in there lengthwise. I'm going to put my right marker on there because it's her right knee that's bothering her. Then the first view I'm going to do is an AP of the knee. So I'm going to make sure she's not rotated. I'm going to angle my tube 3 to 5 degrees cephalic. And then I'm going to make sure my tube and my plate are lined up. From there, I'm going to put my central ray. Half an inch inferior to her patellar apex. And elevate to about a 10 by 12. Making sure I get still a little bit of her femur and a little bit of her tib fin in the view as well. So I'm then going to put some shielding on her gonads and shield thyroid as well. Okay, now I'm ready to take my exposure. For Kayla, I'm going to be using 70 kVp at about 8 to 10 mass. And then I'm going to take my exposure, x-ray, beam, and relax. Okay, so here is my AP knee x-ray. There's a few criteria that I'm looking for when I look at my image here. One is that there's proper collimation, so I just have a little bit of femur, a little bit of tib fib. Second, we want to make sure that that knee is not rotated. We can see that by the femoral condyle symmetric and the tibia intercondylar eminence is centered. We also have slight superimposition of our fibular head, and that's if the tibia is normal. Finally, we have our patella completely superimposed on our femur, which you can see here. Another thing we want to see is an open femorotibial joint space, and then we want to see the interspaces of equal width on both sides if the knee is normal. Okay, so now that I've done my AP of her right knee, I'm going to do a medial oblique of her right knee. So I'm going to oblique her knee 45 degrees. Good. And then my central ray is going to stay the same. It's 1/2 inch inferior to the patellar apex. Center that there. Still has her shielding. I'm still, my tube is still rotated 3 to 5 degrees phallic. And then my IR is still lengthwise, still have my right marker on there. And from there, I'm going to set my technique. Technique is going to be the same. It's going to be 70 kVp at about 10 mass. And then hold still, Kayla, x-ray, beep, and relax that leg. Okay, here we have our AP oblique projection with medial rotation of the knee. There's a few criteria we're looking at here. The first being that we're properly collimated, so we can see the full knee, little bit of tib fib, little bit of femur. Our tibia and fibula separated at their proximal articulation. We also are looking at the lateral condyles of the femur and the tibia. We want to see both tibial plateaus. We want to see the posterior tibia. We want to see the margin of the patella projecting slightly beyond the medial side of the femoral condyle, which is what we're looking at right here. We want to see an open knee joint, and then we also want to see that fibula right here is almost or free of superimposition. Okay, so now I'm going to do a medial-lateral rotation to get a lateral of Kayla's knee. So Kayla, what I'm going to have you do is go ahead and shift towards your left. Keep going a little more. Good, and now bring this left leg over your right leg. And yep, there you go, just like that. I'm going to flex her knee 20 to 30 degrees. Good. And now what I'm going to do is angle my tube 5 to 7 degrees phallic. Now I got to make sure that my plate is aligned with my tube. And I'm going to put my right marker on there. We're still doing her right knee. Okay, my central ray is going to go 1 inch distal to the medial epicondyle. I'm going to call collimate again to a 10 by 12. I'm going to make sure your heel isn't rotated. And then I'm going to proceed with my shielding. I'm going to shield her gonads. Okay. So from here, I'm going to set my technique. For Kayla, I would give her 70 kVp at about 8 mass. All right, Kayla, hold still. X-ray, beep, and relax. Okay, so this view of our knee is our lateral projection of the knee with a medial lateral rotation. Some criteria that we try to look for in the image is that the image is properly collimated. We want to make sure that the knee is flexed 20 to 30 degrees so we have it in a true lateral position. And that's demonstrated by the femoral condyles being superimposed. We also want to make sure that the fibular head and tibia are slightly superimposed. The patella needs to be in lateral profile. And we want to make sure we see an open patellofemoral joint space right here. We also want to see an open joint space between the femoral condyles and the tibia as best as we can. And that would create a good solid X-ray.